Welcome to Disability, Inclusive Employer Practices and Hiring of Individuals with Disabilities. We're glad you're all able to join us today. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness and Disability Prevention Institute, and I'll be co-moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as donations and memberships to WWDPI. We thank our program partners, Canadian Council on Rehabilitation and Work, Education Advisory Committee, and speakers who contribute to this webinar series. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We will collect questions submitted throughout the presentation and follow it with a Q&A based on the questions submitted. Any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website within a week, along with the slides. You will be emailed the direct links for all of these items when they're available. Our co-moderator, Maureen Han, will be introducing our presenter shortly and will also be running our Q&A session. Maureen Han is the President and CEO of the Canadian Council on Rehabilitation and Work. The Canadian Council on Rehabilitation and Work focuses on supporting job seekers with disabilities and employers across Canada. And now I will hand it over to you, Maureen, for Dr. Suzanne Marie Bruyère's introduction.
Thank you so much, Yusra. So it's my great pleasure to introduce Suzanne Bruyère. Suzanne is a professor of disability studies and director of the K. Lisa Yang and Hock E. Tan Institute on Employment and Disability, Cornell University, Industrial and Labor Relations School. The Yang Tan Institute is a research, training, and technical assistance center focusing on disability inclusion in employment, education, and community. Dr. Bruyère serves as Institute Administrative and Strategic Lead and as the Principal Investigator or Co-Principal Investigator of numerous research, dissemination, and technical assistance efforts focused on employment and disability policy and effective workplace practices for people with disabilities. She's the author and co-author of 3 books and over 120 peer-reviewed articles and book chapters on workplace disability inclusion. Suzanne holds a doctorate degree in rehabilitation counseling psychology from the University of Wisconsin-Madison. Dr. Bruyère is a fellow in the American Psychological Association, a former chairperson of the Global Applied Disability Research and Information Network, GLADNet, an executive board member of CARF, the Commission on Accreditation and Rehabilitation Facilities, and past president of Division 22 of the Rehabilitation Psychology of the American Psychological Association, the National Council on Rehabilitation Education, and the American Rehabilitation Counseling Association. Suzanne, I am really looking forward to your presentation, and I hand the floor over to you.
Thank you, Maureen. Thanks for that introduction, and a sincere thanks to my colleagues at WWDPI for the opportunity to be with each of you today. I am delighted to be a part of the broader initiative and very pleased to have an opportunity to share in this context what Cornell University is doing in the area of workplace disability inclusion. The title of our webinar today is Disability Inclusive Employer Practices and Hiring of Individuals with Disabilities. And it's based on our Cornell research, and it's research that we're in collaboration with WWDPI and colleagues in our consortium to look to replicate and to learn from more broadly in the Canadian context, which I am very much very grateful for and very much looking forward to as we launch that this year. Today, we are going to look at specifically some of our work done in the U.S. focused on human resource policies and practices and how they can enhance workplace disability inclusion and across the whole employment process. But we are going to specifically be starting with a focus on recruitment and hiring. So over the course of the webinar, we will hope that you will learn to identify specific internal to your organization HR policies and practices that will facilitate effective recruitment and hiring of individuals with disabilities, and to enable you to think about more broadly how to use internal organizational and external community resources to maximize access to a talent pipeline of qualified candidates with disabilities, and also other considerations about how you might design your interview processes in ways that minimize disability discrimination and maximize equal opportunity for consideration of candidates with disabilities. And we'll also broaden this a bit to talk a bit about more broadly about across the employment process with a focus on the hiring elements of it. So I'm going to start with something that I think probably most of you are already committed to because you are here on this webinar today. But when we talk with businesses, when we provide consultation on these issues, we like to re-emphasize why we're even in this dialogue, why people with disabilities should be a focus for businesses. First of all, it's a significant proportion of the population for each of our countries, but also for the global population. And I'll give you those statistics in just a moment. Also, because we want to be part of a broader movement where there is indeed increasing and fortunately good changes in the perceptions and awareness around the world of the importance of addressing disparities with a focus on employment for people with disabilities, and that there are indeed increasing numbers of individuals with disabilities globally. And in many of our workplaces, this has to do with the aging demographics that we're experiencing, but also because of the conflict across the world. We are also needing to think about how to reabsorb returning from wars and conflict of veterans who are a part of our citizenry, and we want to reabsorb into the workplace. So we're doing this because we believe that workplaces need this pipeline of talent that's largely untapped, but also that it contributes to employment itself, contributes to the independence and well-being, both economic and personally, and health-wise for individuals with disabilities. And so we think it's very important now that business it has a role to play and contributes to this effort of getting people into the workplace and helping to improve employment outcomes. And we know from our research at Cornell, as well as others who work in this space, that there are indeed specific workplace disability inclusion policies and practices which can facilitate the successful outcomes in employment that we're all looking for, and why we're here today together. So here is that statistic that I said it would be coming and to share with you. We think that even though it's significant, 1 billion people with disabilities globally, and then that's 15% of the world's population, we also think that this is likely a low estimate, and that's because many census surveys don't include a disability variable at all. And sometimes even when they do, if it's a largely rural population, it may be that the census doesn't always reach all of the people who would be represented in this number. So we think it could be closer to 20% or 1 in 5 of the world's population. So that's a lot of people, and a lot of people who are kept out of the workforce that we are focusing our attention on today. When you take a look at a subset, this next slide here, people with disabilities, a significant group. I just shared with you that schematic that shows the first bullet here, but the second talks about people working age, and that is a significant proportion of that 1,785,000,000. We're talking with people age 15 up to mid-60s, although many of us, as I mentioned, are working much longer than that. the rates of disability are increasing due to aging and the global increase in chronic health conditions. And we do know, I think this is important for any of us who are in the diversity and inclusion space, that people with disabilities should be a part of those kinds of initiatives, because they are indeed the world's largest minority group. And most of us will experience disability at some point in our lifetime, either ourselves or a family member. 1 in 4 American households has a person with a disability in it. So we know that the impact is broad, whether directly or indirectly. As I mentioned, another reason to take a look, besides the sheer numbers of people with disabilities worldwide, is that indeed there is unfortunately, a shift in philosophy about inclusion for people with disabilities. And a prime example of that transcends country boundaries is the UN Convention on the Rights of People with Disabilities, which came into effect over 10 years ago, 2008. And its purpose is to promote, protect, and ensure the full and equal enjoyment of all human rights and fundamental freedoms by all persons with disabilities, and to promote their respect for their inherent dignity. And 177 countries have ratified that today. And it also includes employment protections, which is what we're focused on, although there are certainly many other rights of people with disabilities that are reflected in what is quite a comprehensive document. So why employment is important, not just people with disabilities, which we talked about its significance, but employment specifically because it's a right of each global citizen. As I mentioned, it actually is shown to have health, physical and mental well-being impact, and certainly impacts our individual sense of worth, as well as promotes economic independence, therefore reducing dependency on social benefits and affording individuals a meaningful place in society where they can contribute their talents and skills to the economy and civil society more broadly. So as a backdrop to the remainder of our conversation, why disability is important and why employment is important, and how things are changing in the regulatory environment set out by the UN more broadly. So now I'm going to turn my attention, and please, if you have questions or comments, do type them in to the chat box as you were asked to do, because I would very much welcome those questions either for now or later. A bit about our research. We at our institute have workplace disability inclusion research gathered from a wide variety of sources. I'm going to focus here on surveys of private and federal sector agencies. We have in-depth interviews of HR leadership, supervisors, employees with and without disabilities that we also do, as well as focus groups. But today I'm going to focus on the perspectives of HR professionals, and we have looked extensively over the past 2 decades at the work of HR professionals in the area of workplace disability inclusion, because we believe that there are important agents of change and key informants in understanding how workplaces can more effectively integrate people with disabilities. In the US context, and I believe that that's true more broadly, globally. I'd be interested to hear the figures for Canada, but we know that in the US there is approximately 100 employees to every HR professional in organizations, and that therefore they are very critical touch points to get a litmus about what's going on in the area of workplace disability inclusion. So we regularly work with our partner, the Society for Human Resource Professionals in the United States, which approaches about 300,000 membership. And we do random stratified surveys to take a look at select key issues. We also have worked with, and I'll talk a little bit about that, but it's not the focus today, with individuals with disabilities advocacy organizations, so that we get the perspective of individuals with disabilities themselves about similar related issues such as workplace disability inclusion and disability disclosure. So we like to look across the employment process. Certainly most employers are looking to get talent in the front door, but many of us, and certainly that's a focus for WWDPI, our sponsor today, also look at retention and career advancement, which means that it's important to look at accessibility and accommodation processes, as well as other factors that retain people, such as equitable access to compensation and benefits, and things like workplace culture, diversity and inclusion, the role of managers, and metrics and analytics. In our time today, we're just going to really focus on the first 3 bullets here and a little bit about metrics and analytics. But certainly there'll be more to come in the many webinars that our host and our sponsor has coming up in the future for you. At the time that we did this survey, the last survey, we've done 4 with SHRM, 2011 survey is what I'm speaking about today. There was about 250,000 members, and we stratified a subsample by industry size and sector, so that we would have something that we felt was representative. And we had about a 23% response rate. We did the survey both online and follow-up telephone calls to maximize participation. And across the specific areas that we looked at, I'm going to start with recruitment. So we surveyed this cohort of about several thousand with a 23% response rate, about 700 people. And what I'm showing you in these slides, therefore, is the responses from that cohort of 700 HR professionals across industries. And we asked them whether they implemented a predetermined list of what we know to be good practices that facilitate recruitment and hiring. And those preconceived group of effective policies, HR policies and practices, were identified from extensive consultation in focus groups and interviews with company HR leadership to determine what was perceived as good practices. And here is what we found. Approximately 3 in 5 did include people with disabilities in their diversity and inclusion plan. And about half had relationships with community organizations, and specifically I mean community organizations that are feeders for applicants with disabilities for the talent pipeline. A little less than half, 45%, said that they actually were actively recruiting people with disabilities. A little more than a third said that they had strong senior management commitment. About a quarter used tax incentives for hiring people with disabilities, which is available to more small businesses in the United States. About a quarter had explicit persons with disabilities target goals for their organization in terms of hiring. About 1 in 5 had internships that were focused on people with disabilities, and less than 1 in 5 said that they had people with disabilities as a target in management performance goals for individuals within their organization. So that's what our respondents told us was happening within their organizations. We had also asked them if they had been hiring people with disabilities in the last year. So we were trying to find out, do HR policies and practices matter? We were hearing from the companies indeed what they were doing. We wanted to see, was there any kind of relationship between those efforts, those policies and practices, and outcomes. So looking at whether they had hired in the last year, we find that these policies and practices do seem to make a difference. We found, after adjusting for certain organizational characteristics, that each practice significantly increased the likelihood of hiring an individual with a disability. And the more practices that were used, the higher the likelihood that companies would have been hiring successfully in the past year. And we found that specific of the policies and practices in that list that I just shared with you with the survey outcomes seemed to make more of a difference. And I share this with you because if you are just, as your company representative, being tasked with starting a program and you're needing to think, where do I start? This may give you some good guidance as to where to focus your energy. Specifically, we found out that companies that had targeted internships for young people with disabilities were 6 times more likely to have successfully hired individuals with disabilities in the past year. And 5 times more likely if there was articulated strong senior management commitment that was communicated across the organization. 4 times more likely to have successfully hired if the company had explicit organizational hiring goals that targeted individuals with disabilities, and approximately 3 times more likely to have been successful if they had either active recruitment, screening, and interviewing for candidates with disabilities, had included a disability focus in their diversity and inclusion plan for the company as a whole, and had relationships with community organizations that developed talent for people with disabilities and provided job placement services that the company was working with. So the policies and practices, these HR policies and practices do make a difference, and some of them seem to make a more concerted difference than others. We always strongly urge companies to consider internships because of these findings, and we find they seem to have multiple benefits. They certainly are a benefit to young candidates who've had little prior work experience, who get exposure to the workplace and can develop not only work skills, but also their soft skills and have something for their resume. But we also find that internships do a significant contribution to the workplace itself because they educate supervisors about what disability is, how capable people are, and raise their own confidence about their ability to successfully supervise an individual with disability, and they get over some of the awkwardness that sometimes we see are impediments for supervisors who are concerned if they can successfully supervise an individual with disability and do the kind of performance management that they would like to do. So it has multiple benefits. We strongly encourage it. So start with internships programs. This is our outcomes, our suggestions based on that. It's the easiest win. Find an executive champion who is passionate about issues around inclusion and neurodiversity. Set concrete recruitment hiring goals as a part of the business strategy. Create organizational messaging about the fact that this is a strategic imperative, that there's an affirmative interest to recruit individuals within this population, and that the company is proactively doing that. And align with a community partner who can source qualified candidates and support company efforts. And spread the word, both internally to build internal allies, but also letting the community know that you are on this path, which will help to rally even more candidates for your pipeline. So that communication, that messaging is really important. We've also found that it doesn't take too long before, if you're successful recruiting candidates, that candidates are happy to have the jobs, but that they're also looking to advance within the organization, and that your existing incumbents who may or may not to date have disclosed they have a disability are also looking for equitable opportunities for advancement. And research would tell us that often people with disabilities, especially visible disabilities, are overlooked because there's a presumption that either they cannot be as capable as their peers without obvious disabilities, or there's a perception that perhaps they aren't as eager as others without disabilities to be on the career development and advancement track, and that's simply not correct. People with disabilities are just as eager to use their skills, advance their skills, augment their skills, and so it's important for us to be aware of these biases and build into our overarching workplace disability inclusion strategy awareness about the importance of equitable access to career advancement and development opportunities. So in this same study of 700 respondents whom we surveyed from the Society for Human Resource Management, we asked them about their policies and practices around career development and advancement, and we found that 3 out of 4 have a return to work or disability management program for employees who are ill, injured, or become disabled, which is good. You know, this is often more true in larger organizations, but these programs we have found is very beneficial because often it means that the companies are aware of what accommodation is, of what modifications of jobs for short-term or longer-term needs for individuals who have disability or incurred an injury or illness is needed. So that's good news, and 3/4 of them have it. A little more than half, 57%, said that they encourage flexible work arrangements for all employees, not just employees with disabilities. But we know for all kinds of purposes, flexible policies and practices can be very helpful that afford either the parents or spouses who have an ill family member, or it can be for short-term needs for other kinds of purposes around health. But flexible work arrangements seem to work for everyone in the workforce. That's part-time, telecommuting, flex time. And most companies seem to be doing that, approximately 3 out of 5. Only 2 out of 5 invites employees to confidentially disclose whether they have a disability on such items like staff surveys. We have seen that historically companies have been very shy about doing that, concerned about breaching confidentiality constraints, and therefore would often not ask. We'll talk about it in a minute. That is becoming less the case because in many organizations that have to prove that they are affirmatively recruiting, getting people to disclose whether they have a disability is a necessity. And so we do see this changing. We find that less than 1 in 5 have any of these items: a structured mentoring program to support people, offer special career planning and development tools for employees with disabilities to mitigate their shyness about coming forward, has a disability-focused employee network or business network, or has explicit organizational goals related to retention and advancement of employees with disabilities, and less than 1 in 10 included progress toward retention or advancement for employees with disabilities in the performance expectations for supervisors. And we know that it's highly unlikely that supervisors will be focused on that as a concern or consideration unless there is some indication that it's important and that they will be held accountable for that. So that is, I think, good information for us to know and go back and examine what we're doing within our organizations, because it's not a likely place we've actually thought about as of yet. So in summary, career development, retention policies and practices, where we also asked them what they thought would be most effective across that list you just saw. And they said they saw as very effective having targeted employee or business network groups. They thought that this was a big advantage in facilitating workplace disability inclusion and retention. Having follow-along case management services for return to work, not surprisingly flexible work arrangements for all employees, but also targeted mentoring programs they saw as beneficial. The next item we looked at more broadly was accommodations, because accommodations are needed across the employment process for effective disability inclusion. And so we looked at it in terms of recruitment as well as retention, hiring, and across the employment process. But we did so knowing that we're focused on the disability population, but one of the statistics I like to share, because I think often we think of accommodation as being something special, and that sometimes can create a negative perception of what accommodation is, that it's just for a privileged population like people with disabilities. And we know from national census data, our US current population survey, that that is just not the case. We find from that survey, and this is data from a paper we did in 2014, but the last disability supplement, which is May 2012, that 95% of accommodation requests come from people without disabilities. So I think this is an important factor for employers to understand and to know that they're accommodating their workforce all the time to help make adjustments that people need just to work and to balance work-life balance. So we need to, I think, adjust our perception that accommodations are just for people with disabilities and need to be as closely scrutinized and vetted as we have historically perceived them to need to be. We similarly to our other slides that I showed you, asked our HR representatives what they were doing in the area of effective accessibility and accommodations. And again, we had a pre-existing list of 8 good practices, and we found out that 3 out of 4 have a designated office or a person to address accommodation requests, which can be very helpful. Almost as many allow an employee to exceed the maximum duration of medical leave as an accommodation. About 2/3 had an established grievance procedure to address reasonable accommodation issues. Approximately 2 out of 5 had a formal, written or documented decision-making process for the case-by-case provision of accommodations. A little more than 1/3 either had provided a notice to job applicants that reasonable accommodations can be provided during the application process, or evaluated their pre-employment occupational screenings to ensure that they were unbiased. A little more than 1/4 regularly reviewed the accessibility of their online application systems to see if there was any impediments in the design for people with visual, hearing, fine motor dexterity, or cognitive impairments, and a little less than 1 in 5 reported having a centralized accommodation fund. We similarly asked them about their perceptions of efficacy of these very same policies and practices, and what we found is that even though they might not be doing these things, as you might recall, less than 1 in 5 had a centralized fund for accommodations, but when you asked about efficacy, most of them thought that this was one of the key things that would help with having an effective accommodation process within their organization, as well as a point person for questions, a formalized accommodation request process, the use of internal and external resources when needed, targeted training for supervisors about accommodations, and embedding awareness accommodations throughout the HR process, not just on the front end when people come in, nor in the incumbent part of the employment process. I mentioned that we also look at metrics because what we all know is that it's one thing to have a list of good practices and be trying to implement them. It's another to really look at whether or not, as we roll things out, they're effective. So we also asked our HR representatives what their companies were doing about measuring some of the things that we were looking at in each part of the employment process. And we found that, and I'm going to roll all these out in the interest of time, that there were far fewer organizations tracking information than there were really actually trying to implement many of these good policies and practices. Only less than 1/3 had kept data on accommodations or number of job applicants with disabilities that they were hired. Only a quarter kept the number of job applicants. Less than 1 in 5 looked at statistics or kept statistics on employee retention and advancement, or grievances from employees with disabilities, or less yet 14% compensation equity, or less yet 11% looked at turnover rates for employees with disabilities to see if they were different, higher, or lower than other members of the workforce. So few metrics being kept, certainly far fewer than is being kept for other minority populations. I want to take a little bit of time to talk about disability disclosure. And the reason is we're finding that this has been a significant impediment among American, but it's also, we're seeing global workforces. And it's an impediment in two ways. One can be that people with non-obvious disabilities, unless they perceive that there's an affirmative hiring program for people with disabilities, are not willing to disclose on the front end of the process. Therefore, they can't take advantage of any affirmative hiring programs that your company might have because they're fearful if they disclose that they have a disability that they might not get equitable consideration. It also is a significant problem because we have in our workforces many individuals whose disabilities may have evolved over time because of chronic health conditions or the aging process, and who are hesitant to let their supervisor or the HR or other appropriate representative know because they're concerned about negative impact on their career advancement or their retention opportunities. And that means they don't get the accommodations that they need to stay maximally productive and engaged in their workplace. So it is a loss both for the company as well as the individual. And now we know, as I mentioned, that there are certain regulatory frameworks in each of our respective jurisdictional settings that it can incent us as employers to count individuals with disabilities, both the applicants and as incumbents. And in many countries there are quota systems. In the US we don't have a quota system, but we do have an aspirational target of 7% for US federal contractors of $10,000 or more. So there is certainly much more interest now in what comes to about a quarter of the American workforce who are federal subcontractor employees, in examining how to effectively get people to feel comfortable coming forward and identifying as an individual with disability and getting the kinds of supports they need to stay effective in the workplace. And we also think this is important not just for accommodations, because I think each of us are benefited from being able to bring our whole selves to work and let the workplace and our colleagues know who we are, what our full identities are. So we think this is an important area. Sharing of disability status can occur at application, during a job interview, once hired, when an accommodation is needed. And as I mentioned, this happens in our US regulations now. And even though this has been on the books for many years, it's only the last 4 or 5 years that there's enforcement is actually, and that target has actually been in effect. So it's quite recent for us. And yet in a survey that we conducted in the last 2 years, we're finding that companies are struggling to get people to identify. We believe that there's probably far more people who are in that workplace than who are willing to identify. And in a survey that we did of federal subcontractors to assess the effectiveness of Section 503 of that this new law represents, as you can see here, 85% said that they had less than a 7% self-identification rate on the required forms that they are periodically asked to do. So it's a challenge, and I think both in terms of getting your applicant pool, maximizing your recruitment, but also understanding who in your workforce may need supports. It's important for us to look at why is that the case? How can we convey to workplace incumbents and applicants that we want them and that we're willing to accommodate them, and that disclosure will not have a negative impact on positive outcomes. We've asked people, I mentioned that we've done a survey of individuals with disabilities, and we asked a group of about 600 people with disabilities about their perceptions about what maximizes disclosure. And the people are more likely, if they need an accommodation, to disclose. Also, if they have a supportive supervisor relationship. That's the top 2 reasons. About 2/3 said they would be willing to disclose for these reasons. Also important for disclosure, if they had a perceived disability-friendly workplace, more than half. And some of the ways that they perceived that was if there was active disability recruiting occurring, or knowing of the successes of others who either as applicants or incumbents asked for accommodations and got them and disclosed, or if they see disability in the diversity statement. About 2 out of 5 said they would disclose if they thought there was a positive reason to do so in terms of being advantaged in new opportunities. And that's where such things like career advancement programs, mentoring, coaching come in. If people observe that you are proactively trying to advance individuals who are in your workplace, who are people with disabilities, others are more likely to come forward. They also told us what doesn't work in terms of facilitating disclosure. And the first is their own perception of risk of being fired or not hired. About 3/4, about 2/3 said that concern the employer may focus on disability, or in the US, this is particularly a problem, a risk of losing the health care that comes along with being employed, and as well as a fear of limited opportunities, or that the supervisor may not be supportive, or that they be viewed or treated differently. About 2 out of 5 said no impact on job ability or ability to advance. They wouldn't be willing to risk it. And only about 1/4 expressed this as a concern about privacy. So privacy did not seem to be the issue. I also want to mention, we are focused on HR because we have certainly believed over many years that HR, the HR representative is a really important part of building an inclusive workplace, but managers' roles are also really key to a quality workplace experience. And I would say that the perceptions of the manager as to what's driving the organizational focus on disability is really important. It's important that they perceive it to be true inclusion interests rather than just legal compliance and a concern about being within the law. And the disclosure most often occurs with the manager or co-worker rather than HR. So getting to them and letting them know what's important and that their role is really critical. We found in our work that at least that employees with disabilities are at least 60% more likely to disclose to their supervisor than to HR. So keeping them informed is really critically important. The conditions under which disability disclosure is more likely to occur is if the individual perceives the disability climate is positive in the organization, and then I mentioned a few of the obvious indicators, that they work in climates that are workplaces that have an inclusive climate more broadly for other kind of underrepresented minorities, that they perceive that HR practices are fairly implemented across all people in the organization, and that the organization is committed to genuinely to disability inclusion. And again, here, very critical that they have a close, trusting relationship with their immediate supervisor. So in summary, across all of the things we've discussed, it's important to develop top leadership commitment, assign responsibility to someone in the organization for attracting, engaging, and advancing employees, find a community partner who can be helpful in identifying the talent, establish such things internally as business resource groups with a disability focus, help to make managers accountable for helping with this inclusion process, and measure for understanding and results, make it safe to self-identify, and raise understanding and skill levels with everyone in the workforce about disability etiquette, understanding, and inclusion to reduce the fear of interacting with people with disabilities, and also ensure that managers understand their roles and accountabilities. So I have also shared here a set of various online resources that are free and available to the public. There's a course, there's online resources from Cornell, and also bibliographies about related publications. But I am now going to pause. All of these, I'm sure our sponsor will share with you and make available, and we'll take some questions.
Yes.
Maureen, do you have questions for us?
I do. We've had some chatter, so this is wonderful. So thank you so much. So the first question is, if an organization is willing to implement a return to work and disability management program or programs, what do you think the first step of the process should be?
And is this disability management programs or recruitment programs?
Well, I think that it's specifically to return to work and disability management programs.
So, all right, that's great. I think the first thing to do is to likely, if you're a larger organization, I think get an employee resource group together. I think this is where employee business or resource groups are really important places to start. Get a litmus from your own workforce as to in several ways as to where the critical issues are. I think talking with employees and trying to get their input as to where they see the pressure points and return to work is really important. I think looking at company data to find out where the highest proportion of lost work days are, both in terms of units, in terms of causative factors, and where there are extended stays out of work, trying to get a handle on where the pinch points are. And then I think getting either an external vended service of case management services or creating support services within your organization that can facilitate both supervisory interaction with the individual that's supportive, and an understanding of what the healthcare provider determines is an effective process for return to work, and also supporting that individual and navigating services is really critical. And I'll just pause there.
Okay, excellent. Thank you very much, Suzanne. We have a second question. You've spoken a lot about disclosure, and I have to say it's probably the most comprehensive piece of information that I've heard in a while around disclosure. So thank you for that. But there was somebody who asked the question: we invite employees to disclose whether they have a disability, but find that they are not willing to do so. In some cases, we have done a formal accommodation for an employee and find that they have not disclosed that they have a disability through our systems. What should we do to help employees be comfortable disclosing for our data collection needs? Is it appropriate to update our systems when we have made an accommodation if the employee hasn't voluntarily updated their record? Good question.
It's an excellent question, and I will tell you that we are not allowed. When I say we, I would say Cornell is ourselves as an employer, but when we provide guidance to other employers as well, to make the determination ourselves at either face value or because an accommodation has been requested, make the inference that the individual has a disability and mark them as such, which is why our approach by our federal government is to encourage organizations to ask at application and then annually, and because to give people an opportunity to at different points in the employment process to self-identify, because indeed people are unwilling to do it. But because so many people ask for accommodations and may not necessarily have a disability as defined by our regulatory protection mechanisms, our federal government, and I think it's actually is good practice, don't lay labels on people. We certainly would not do so if there was any ambiguity about race or ethnicity. And I think we have to think about this in this context of how we deal with other self-identification mechanisms and try to be consistent in the parameters we put around those kinds of approaches.
Excellent. Thank you, Suzanne. Our next question is Are you able to give more concrete strategies or examples for effective practices to accommodate or recruit employees with disabilities? What do programs involve, and what are some successful approaches?
Yes, I'll go back to what I shared in terms of internships. Again, if you can do one thing, I heartily recommend internships. Recruiting from local area community service providers, putting defined time period, whether that be 90 days in the summer or 4 to 6 months other times of the year. We encourage, and in some cases countries necessitate that they be paid internships, that they be clearly defined goals. It's a wonderful way, low risk way to test out the expertise of the individual and to build a culture of inclusion among the management team. So that's number one. In complement to that, we encourage partnerships with local area community service providers, but also with institutions of higher ed and also with high schools. We see many companies who are proactively creating a pipeline by reaching into the educational institutions from which they hope to draw candidates, creating scholarship programs, creating company familiarity programs by bringing candidates proactively into their workplace long before they actually will be applicants, and giving them information about the company. So they may have open house days, or visitation days, collaborations with career counselors, or go out to those institutions. But that seems to significantly heighten the likelihood that students will be thinking about this employer, thinking about the kinds of position openings and careers that they have, and it builds a pipeline for the longer term.
Excellent, great points, thank you. The next question is, can you give several examples of the type of accommodations or adjustments that the non-disabled population is requesting, since these occur with significant frequency over and above those that people with disabilities ask for?
Certainly I can. I think if any of us who are in this webinar today can think about the kinds of requests we ourselves think about, they certainly are similar to the ones that individuals with disabilities might ask for, but they often have to do with flex place, flex time, telecommuting opportunities, adjusting hours. It might be that someone's teaching Little League, softball, lacrosse for their 8th grader in a particular season of the year, and they ask if they can come in an hour early and leave an hour early. It might be, needing to go home at lunchtime, so needing an extra 15 minutes to care for an elder parent who is now residing in your home. Or it can be getting an ergonomic chair and not having what would rise to the need of a person with a significant back injury, but just it's more comfort for an individual. So we ask for these kind of accommodations all the time, and I think more employers are thinking of these as more productivity tools and adjustments than accommodations for the general workforce population.
Excellent, thank you, Suzanne. And I like how you worked lacrosse in there as part of your answer. So as a Canadian, I thank you very much for doing that. Yes. We do have another question. It's a bit of a personal question, but it's from a person who says, I am working in detox. My employer would not let me come back to work because they stated I could not do 2-person CPR. They did not allow me to show them how I could do it. My opinion is that they did not have an interactive process. They just told me how it was going to be. What's your take on this, or do you have any experience with this?
Well, I don't have experience with the particular procedural concerns you have, but I will say more generally that we encourage employers, certainly at all parts of the employment process, but we're certainly seeing many more employers doing this on the front end in the application process, of allowing individuals, if there is a question about the individual's ability to perform a particular skill or required tasks in a job description to afford the individual a situational assessment, or what I'll call a situational assessment, where the individual is afforded an opportunity to demonstrate that skill. And we do see companies making changes in this regard. There are many companies now in the US who are doing affirmative hiring programs for persons with autism who may not necessarily interview very well. And so the companies are adapting their screening processes to afford individuals an opportunity to demonstrate behaviorally that they can do certain tasks, rather than having to go formal interviews where they're required to verbally interface and describe that, which they may find too difficult to do and not be successful in that interview process when indeed they actually have the skills. So it's a fair request. I think it's just, you know, not all employers may rise to the occasion of affording that kind of different way of demonstrating skill.
Thank you, Susanna. Just for my clarification, it was RN, but of course I don't have my good glasses on, so I believe that was from a registered nurse. So that was
okay.
The take on that. We do have one more question, and that is, in the federal workplace, we can update disability information for Schedule A hires, and that is if the person does not disclose. So why can't we do that for reasonable accommodations?
Because if in a Schedule A hire, the individual is actually determined to be an individual with a disability. So there is a vetting process that occurs where the individual has disclosed as having a disability. Unless the record is attached to that, I suppose if the record was attached to that process where the individual has determined that they're willing to disclose for the privilege of having Schedule A consideration, then it probably could also be attached to their accommodation. But, you know, as I mentioned, 95% of accommodations are by people without disabilities, so I don't think we can infer, therefore, that because a person asks for an accommodation, they are automatically a person with a disability for purposes of counting for, you know, reporting purposes.
Excellent, thank you. So those are all of our questions, Suzanne. I just want to thank you so very much for your presentation. I thought I knew everything, but I certainly don't. When you spoke about the Convention of Rights for Persons with Disabilities, the exciting part is that Canada has signed on to this and was actually very, we had some very strong members of civil society in the development of the convention. So that's very exciting. And that this is leading to our Accessible Canada Act that has been tabled in the House of Commons that should be coming up for a vote before the end of June. So that will most likely have some influence on most of the people that have taken place in this webinar. And I just love the stat that 95% of the accommodation requests come from people without disabilities. I think that should be front and center for a lot of the work that when we're trying to talk to people about accommodations and people with disabilities and employment. So Suzanne, thank you so very much for your time. It's much appreciated. And I'm going to hand this back to Yusra for any type of follow-up.
Suzanne and Maureen, we're honored by your presence today. Thank you so much. It's truly a pleasure to have you today. Excellent webinar, Suzanne, and amazing work. We greatly appreciate the time you took to shed some light on HR policies and practices to make the recruitment and hiring of individuals with disabilities more effective. Thank you. Thank you, Maureen, for moderating the webinar and for your valuable contribution. We also thank our audience for your interest and participation.